A common question that's asked is, can I get back to my yoga practice after a hip replacement? Or maybe you want to start yoga and you're wondering if you can do it, what poses are allowed, or what precautions you have to follow. And usually the answer is yes, you can begin or resume yoga after a hip replacement, but it must be done thoughtfully, with modifications at first, and definitely with your surgeon's approval. If you've been doing yoga for a while and it's part of your identity, your stress relief, your community, then the thought of reducing it or eliminating it is really devastating. That's not something we want to do, and I can completely understand that feeling of great loss or anticipating that you may not be able to do it, but you can. In most cases, you can get back to it, and you want to get back to it safely and thoughtfully. Hi, I'm 𝗛𝗶𝗽-𝗘𝘀𝗀. I'm an 8-time world champion athlete, personal trainer, and the creator of 𝗛𝗶𝗽-𝗀𝗃. I've had both my hips replaced successfully and been able to get back not only to yoga, but to my athletic endeavors. And I want to help you on your hip replacement journey so that you can stay strong prior to your procedure, get strong again after, so you can get back to all of the activities that you love, including yoga. In this video, I'm going to walk you through a few things, such as when is it safe to start your practice again, things to avoid, things to have in place before you begin, how to make modifications, and how to think about your practice now after your procedure. Now, before anything else happens, you must get medical clearance from your surgeon because every procedure is different. The approach that's used may be different from somebody else's, the materials that are used in the implant, your tissue quality, and your healing time. So you have to get the permission. That's your responsibility. And it may be helpful to bring some pictures of different poses so your surgeon can understand what you are intending to do, as opposed to just saying yoga in general. It's good to have that visual so they can say, yes, you can resume this, or you want to wait a while and modify, or do not do this position. And some people may have these precautions permanently. It really depends on your tissues, your body, your age, and the capacity for you to do certain movements. Again, everybody's different. So speak to your surgeon, bring in the photos, and see what they say. So it's not about thinking, well, I feel good today, so I'm going to go back to my practice and see what I can do. Or, my friend got back to it within 6 weeks, so I should be able to also. It doesn't work that way. We want to be gradual and be safe so you can continue your practice for the long game of life. The reason why you want to take your time getting back to some of these poses is because of the risk of dislocation. And while it's rare, it needs to be respected, and that's why you want to go in with caution, just taking your time, gradually easing back. The risk of dislocation is usually 1 to 3% of people within the first year, and usually it happens within the first 3 months. Dislocations can often happen because of falls, as well as positions that include deep flexion combined with rotation, such as different poses that happen in yoga. You'll want to wait at least 3 months to get back to your practice, and when you do, and when you have your permission, you want to do things like gentle flows, chair yoga, or restorative yoga. If you're taking classes, be sure to tell your instructor that you've had a joint replacement, and then it's up to you whether you want a hands-on assist or not. Maybe you want to just feel the pose yourself and not have them assist you. If they do touch you and assist you, then make it really gentle. But the instructor can help provide tools to help you with the modifications, such as pillows or blocks, things like that, that will ease you into the poses. Keep in mind that in the first few months after your procedure, your tissues are healing, your bone is growing around the implant, your joint is becoming more stable, and you're going to get more confident with your movements, and your body and brain, your nervous system, will realize that movement is safe again. Your practice before your procedure may have been about finding out how deep you can go, how much you can rotate, how long you can hold the pose, and that's all great. But now, after you've had your hip replacement, the tissues are still healing for sometimes up to a year. So we don't want to test the joint. We don't want to stretch it. We don't want to open it. We want to keep it stable, under control. Now, in the first year after your procedure, you want to be especially cautious with certain poses, such as pigeon pose, full lotus, lunge with torso rotation, malasana pose, or aggressive assist from the instructor. Here's what generally works to get back into it. The first point is you want to start upright and supported. So things like restorative yoga, chair yoga, or standing flows. Remember, you want to build control first and then depth comes later. Number 2, no forcing. There shouldn't be any discomfort and especially no pain. If there is, please stop. To modify, instead of poses like deep seated folds, you can sit up in a staff pose. Instead of a deep lunge with rotation, you can do knee on the floor lunge with blocks for your hands. For full lotus, you could do something like butterfly pose with blocks. For pigeon pose, you can do a figure 4 on your back with your foot on the wall. For forward fold, you can do a half lift. For malasana, you can sit on a block or even sit on a chair. The third point is huge. This is about creating stability before you create stretch. This has to do with strength. Strength in your hips, your hip stabilizers, your glutes, your core. This is so important, not only to get back to yoga or other exercises and activities, but for daily life. You'll gain this strength and stability by doing things like dead bugs, bird dogs, split squats, step ups with controlled lowering, plank positions, and all of these movements and more for strength, stability, balance are in my hip ease course to get you strong before your procedure and then again after your procedure, after you've been released from physical therapy. And number 4, how do you feel in the day or days after you did your practice? Is there swelling anywhere? Is there a lingering soreness or achiness? Just be aware of that. So it's not about how you feel in the pose in the moment, but in the days afterwards. So you can feel your body, take note of what's happening, and then slowly and gradually progress. Patience will be needed for your healing timeline. I know we can get our ego involved in our performance and how we feel and how well it went or didn't go. And I can completely relate to this, especially after my first hip replacement. I didn't think I'd ever get my balance back, but I did. With strength training and single leg work, it did come back. So the message is be patient, have some grace for yourself, and it will all come together in time. And now this is the time when you can put the philosophy of yoga into practice, which is staying grounded, staying present, breathe through it, and be where you are now. I wish you all the best with your hip replacement journey, no matter where you are on this road and all your activities. If you want more information about hip ease, which is for active adults either preparing for or recovering from hip replacement, I've got exercises for you to stay and get strong again, done for you checklists, so many resources, everything that you need that your doctor or physical therapist doesn't touch on. See the information below, and if you like this video, please share, like, and subscribe. I'll see you at the next one.